Hi, I'm John Hinwood from Casuarina Beach in Australia. I studied chiropractic in Canada, in Toronto, Canada, as it wasn't possible in the early 70s to study chiropractic in Australia. And when we came to April of 1976, I was entering my final year and I started my internship. During our internship, we had to see X number of patients over a year and have many things signed off as one of our requisites or prerequisites to graduate. And you had to find your own patients. And I was really excited, and Judy, my wife, was a year behind me, and she was working as a waitress in a top 5-star restaurant. And she came home this night, she says, "I've got your first patient, I've got your first patient. It's fantastic." She said, "It's Maria, this Greek lady I work with, Maria Patrapoulos." And I thought, "Oh, that's good. Waitress, bad back, yeah. Chiropractors were good with bad backs." And she said, I told her you could fix her up so she has a baby. I said, "What do you mean, Jude?" She said, "Well, she's had 8 miscarriages, and her family is just in an awful state. Her husband's about to leave her because she has to have a child, being a good Greek girl. And she doesn't know where to turn." I said, "Go and see my husband. He can fix you and you'll have a baby." So Judy had all the faith in the world that I could help this woman, Maria, have a baby. So Maria comes in and I go through all the procedures she had to do in a teaching clinic, and then we start care. And she'd miscarried anywhere between about 4 weeks and the longest had been 10 weeks. So we started working, and she knew that she was about to ovulate within the next few days. And we just checked her out. She definitely had problems in the lower part of her spine, that they were the nerves that went to the reproductive organs. And I said, "Look, I don't know what we can do, but the nerves that go there, if those nerves have pressure on them and they're stopping the vital life force getting there, and we can take that pressure away, then your body has a chance to heal itself and you could have children." And I said, "Do you have back pain?" She said, "I have no back pain. I have no pain. I feel great. It's just that I keep miscarrying children." So we worked away and she ovulated and things went on. And Maria had her baby 8.5 months later. And Maria was over the moon. And that was Maria's miracle. It was her husband's miracle. It was her parents, his parents, the family. There was massive rejoicing. And, you know, I was putting on weight because every time Maria came in, she brought me a big box of baklava. But the interesting thing was I still had 3 months of my internship left. And a week wouldn't go by without me getting a phone call. And that phone call came from a Greek male. And I get a pager, "Intern Hinwood, line 1. I'd answer it. "This is John Hinwood. Look, my name is a con, and I'm phoning to call you, doctor, because of my friend Maria. You helped her, and she's now got the baby. Now, my wife Anna, she can't get the pregnant either, and the families are giving me help. Everyone's giving me help, and I'm sending it in here so you can give it the baby, doctor. Now, I don't care what you do, I'll lock it in the room with you, doctor. It don't matter, but what you got to do is fix her up, doctor, and give her the baby." I said, "No, well, you need to understand that if she has a problem, and we examine her and those nerves that go to her reproductive organs are affected, and we accept her as a chiropractic case, well, we do that, and hopefully your wife could be like Maria and have another child." "Doctor, you're not hearing me. You're going to lock her in the room. Just fix her up, doctor, so she gets the baby, because, you know, I just fire blank ones, doctor." That's what the doctor told me. They know about me. And it was just amazing. I had these calls that went on for those months till I graduated from Greek males who just needed me to fix their wives up so they could have babies. So the miracle was that Maria had her miracle, and she wanted every other Greek couple to have a baby like she did. And I start practice, and in my second week of practice, somebody sends me in a woman who'd had a child 6 months previously. 6 weeks previously. So she had some back pain, and she was very in a great deal of discomfort. So I worked with her, and in the course of working with her over the next week or so, she was telling me that she was having great trouble getting any sleep because her baby of 6 weeks had never really had a bowel motion since birth. Had a little show, but had never had that really first bowel motion a baby has where it's just all black and absolutely putrid and nothing ever, just a little dribble that happened. So I said, look, go home, bring the baby in this afternoon. I'll check the baby out. If I see there's anything there that chiropractic can help, we'll get started. So she goes home and she brings the baby in, and I checked the baby, and the baby definitely had some problems. And I said, well, look, we'll get started now, because this baby had a very distended abdomen. The baby was just looked absolutely awful. It was yellow. It was just, awful state. And there's a technique in chiropractic where you hold a very, very gentle pressure with your thumb. It's uncomfortable eyeball pressure, so it's very, very light, just off to the side of the anus. And it's a reflex technique that works beautifully if there are problems in most areas, particularly in those areas that control the nerves to the bowels. And this little baby's rolling all around the table. It was just so upset. And I'm holding this locum contact, it's called, and I'm sort of back behind the baby, and all of a sudden the baby screams, and as it screams, it just fires out this stream of black and then poo, and it came out just like someone had turned a fire hose on, and it went all over me, head to toe. And it came out at such an incredible burst. The wall was only a couple of feet behind me, and you could see my silhouette on the wall. And it was, and the mother's screaming, just screaming with joy. The baby's screaming, and then the baby sort of calms down and goes straight to sleep. So I get up, and I had no other clothes with me. I lived at the other end of the city, and we didn't have a shower at the practice, so I had to go into the bathroom there, and in the tap, just get a bucket and scrub myself down, and I just smelled foul. I had to go and get some deodorant to spray on me. I had no other clothes, so I put on a patient gown with nothing under it, and I practiced the rest of the day, that afternoon and evening, just with a patient gown on, no shoes, socks, nothing. And we had to get someone to fumigate the room. And we couldn't use the room for a week. It was just foul. And the mother was so happy. She brought the baby in the next day. She said, the baby's sleepy. It's had another bowel movement. We're just over the moon. And she said, look, my mother lives in Los Angeles, and she's made arrangements to fly up tomorrow so you can see her with your problem. She's seen lots of people, and I've told her why I can, so she's sure you can help her. And she's flying from Los Angeles to Toronto, saying, I'm in practice for 2 weeks. There are so many outstanding practitioners, a third of the world's chiropractors are in California. But it's amazing when something happens in a family unit or in a group of people close together that's their miracle. They just want to share that miracle with so many other people and have so many other things happen. And it was just beautiful to see that little baby, what happened. And of course, it just, as I said, it just fell off to sleep while there's commotion going on around it.